Hi guys, it's the Dental Assistant Tutor, and today I would like to talk about the basic setup. The basic setup normally consists of a mirror, and let's talk about the mirror real quick. The head comes off and you need to interchange them whenever they become scratched by the handpiece. Then it's like a nice clear mirror to see. Don't forget to spray your air and water on them to keep them clean when he's using or she's using indirect vision. Okay, make sure you put your mirror on tight so it's not loose. Then you have your Explorer. This is the Shepherd's Hook one. Now the Explorer is to check for cavities, check sealants. It's your little checker, okay? And what you're gonna do is you're always gonna pass the instrument like this, okay? So when you're ready to give the Explorer, if the doctor's working on the lower arch or the maxillary arch, you're going to have it ready for him to use it, or her to use it, okay? So you're going to hold it at the opposite end of the working end. So this is the working end, so this is the opposite end. This is the handle. You're going to hand it like this, and then they will grab it. Put it in their hand to where they feel it, okay? The object is they shouldn't look up, okay? When they look up from the patient's mouth, their eyes are going to distort it, and then they're going to have to refocus, especially if they have loops on. So always hand it like this, all right, and over the patient's chest. Now that's one Explorer. If it looks like an Explorer, just like with any instrument, chances are it's an Explorer. Because this Explorer, maybe at this office, they order the ones with the pigtail end, okay? I've never really used those ends, okay? So you have these two. Then you have one that has a perio probe at the end in the Explorer. That's pretty handy because then they can just flip it over, okay? Remember, like that. Another thing is when you have your gloves on, if you're passing an instrument and you know there's two ends that are pointy and one's going to face up, never hold it like this because you can get cut with your glove. Okay, so always hold it under, not over. Under. Like that. If you have an Explorer with no perio probe at the end, and it's a new patient exam, chances are they're going to check the periodontal pockets. And so you can have just a periodontal probe by itself also. They come in different colors too. The most common one I've seen is a yellow one with black lines with a red tip. Remember when you're charting periodontal, when the dentist says it's bleeding, to circle it so you know that it's bleeding, or check the B on any of the dental programs and that it's bleeding. Alright, so that is the basic setup. Don't forget, you have to have cotton pliers with every setup. So the mirror, Explorer, and cotton pliers are your three main instruments in every single setup. So now that you know the first three instruments for every setup, check out the other videos and learn the other instruments so that way you can be ready for your new career. Bye guys. Don't forget to like and subscribe.